Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Nira Prasad, with my background in pediatrics, emergency medicine, urgent care, affiliated with major Auckland hospitals, St. Joe, Auckland, Beaumont, and Henryport. Joining us today on my health talk is Dr. Abbas Havasian, and she is a practicing physician for pulmonary interventional medicine. She's going to highlight our viewers about the lung cancer, how the diagnosis early diagnosis, so they can have the benefit of early treatment, and what are all the treatment options that are available for us. So thank you, Havasian. Thanks for coming to my show today. So before we start, will you please give your introduction? You have done so much work. I was looking through your CV and all those, so I will let you let you talk about this.
Good morning, Dr. Prasad, and good morning, everybody. My name is Dr. Abbas. I'm a pulmonary critical care sleep and interventional pulmonary. We choose today to talk about the lung cancer because the lung cancer, it's when you hear about it, it's the most, unfortunately, feared disease, but few understand the lung cancer. And then my goal today is make it less fear, increase the awareness of lung cancer, and help people when to seek advice or to see a physician earlier.
Exactly, yeah, because this is so common. People come all the time, so we have symptoms, this and that, and but then most of the time, initially we all ignore it, right?
Very true.
Yeah, so okay, it's a little bit of cough, it will get better. Why go to the doctor?
Very true.
So why are we talking about this nationwide? Because it has become a nationwide.
Lung cancer, it's the most common nationwide, worldwide, most common cause of cancer. And sadly, most of the time we detect it late, so make the treatment is very hard. But the good news that early detection can help and save life. So that's why we always talk about it and talk about early detection.
So it is nationwide. Is there, I did so much studying, look through the literatures and anything. Is there any, what kind of people, can you comment on more common in which age group? I mean, not age group, which ethnic background?
So the risk factor, we can say, the risk factor is, number one risk factor is smoking. Also secondhand smoking. There is some air pollution, workplace exposure, and unfortunately there is a percentage of the people that they never smoked in their life and they do have lung cancer.
Still, yeah. So that is because of secondhand exposure, right?
It could be some of them genetic. So there is so many causes that people who smoked and people never exposed to anything in their life, but they still have a cancer.
Right, yeah. And with my pediatrics adolescent background, I have seen all the kids, adolescent, they used to do e-cigarette. Now, e-cigarettes are not as common as it was before, right?
Because it increased the awareness of the disease.
Yeah, it's weird. Now they have come up with something else.
Like a vaping or something.
Vaping.
There's always something.
There's always something.
Very
E-cigarette is gone, but there's a vaping. Yeah. So those are the people who are mostly involved,
in the lung cancer.
Now, precipitating factors. Can you just describe a little bit more besides this?
That's kind of the most common, the precipitating factor, as we said, with smoke. Workplace, it's also a big deal, like being exposed to asbestos, working in carpenter, yardship. This also increases the risk.
Lifestyle,
very true.
Has a lot to do.
And family history also play a great role.
Yeah. Or people, is there any age that you can think of? What age to which age we can screen them?
That's a good question because if now the screening is usually when after they did then so many trials. The most common trial is an SLT trial. Is they found the screening between age 50 and 80. So
age of 50 to 80
I would put
for
that's
our
the
viewers to
most.
know. Okay.
So that's most of the people we ask about screening. So that's they found the high risk,
Yeah,
especially
right.
smoker.
Yeah, so usually age over 50, and plus there is some genetic factors too.
Yes, unfortunately, family history play a great
Family
role.
history.
Personal history, if you have any kind of cancer, it's put you high risk. Lifestyle, as you said, what type of job you're doing or you used to do. So that's all this kind of adding a risk factor. And then when we're going to talk about the symptom, if we add this risk factor with the symptom, that's kind of make it high risk people, intermittent or low risk people.
Low. Okay, so those are the kind of people that you suspect they should be checked at your office. So working at the emergency room or pediatrics or in urgent care, I see all those people. All people of different age group with different symptoms and all that. And basically, I get a lung X-ray. I get an X-ray. If the X-ray, even if they have a little kind of suspicion, that it doesn't look normal, I send it to you, to your office. So when they go to your office initially, what do they expect? What will you be doing?
So if we talk about the diagnostic part of it, the diagnosis, we do it through low dose. It's called low dose CT scan.
Low dose
CT scan. Unfortunately, chest X-ray missing so many. So now when we screening or when we suspect it, as you said, if there is abnormal chest X-ray, the first thing we do is low dose CT scan.
CT, right.
And the CT is the diagnostic to detect any type of lung nodule.
Yeah. So basically, for the viewers, a low dose CT is recommended by you.
Definitely.
And once you get the CT report, and
that's a
it
screening.
helps you diagnose, right?
Yeah. So if I want to, if a patient came in with a symptom, and then we suspected, like we do a screening, we do low dose screening. But if there is already something abnormal on a CAT scan, then we jump into a diagnostic CAT scan rather than screening CAT scan.
And then you jump to the diagnostic modalities, and oh my God, there's so many in
Very
the
true.
diagnostic.
Very true. Very true.
Diagnostic
Very
modalities.
true.
The NIH group has done so much work. The FDA has approved so much.
So many. Very
So
true.
many, yeah. So, and also some of the insurance company, they have approved the basic test.
Yeah,
that
low dose screening CAT
Low
scan
dose.
for appropriate age group, for appropriate patient. It's
Yeah.
approved and it's mandated. It's from the age of 50 to the age of 80 for any patient who smoke more than 15 pack a year,
Right.
20 pack a year and quit less than 15 years. So that's approved. So
They have
that's why we encourage anyone who's been smoking or quit smoking, but he quit less than 15 years to go with the screening CAT scan. It's not, unfortunately, one time you do it, it's a yearly base.
Yearly basis.
Because
yeah.
if I go
that
back...
was my question from you. How often they should be followed up with this low dose CT?
Yeah, if we are talking about screening CAT scan for a smoker, it's a yearly. Every year they have to do it till the age of 80. But we are talking about screening. If we found something, a nodule or a spot in the lung, then we are going from a screening part to the diagnostic part. So it's going to be different throughout.
It might, so depending upon what it is, the follow-up strictly depends upon what are the kind of...
What we are seeing.
Yeah, what you're asking.
Very
yeah.
true.
So, a couple of years ago, I had a guest speaker from Wayne State, a pulmonologist, and very interesting. This was early 20. I have been doing this show for last almost 25 years. So what he did is, he brought a big jar
I see.
full of smokes. So
That's
those were all from the cigarette smoke.
Very
I
true.
said, what is this? He said, this is what happens when the smokers, they have
Very true.
this, and it's very interesting, how much smoking is the precipitating cause of lung cancer, right?
Very true.
I see the patient in emergency room, people come with a shortness of breath, cannot breathe. We give them, the breathing treatment and all that. But guess what? They go to the lobby and
They smoke again.
smoking it.
Very true. Yeah.
So tell me, what do you think about the whole situation? Addiction, right?
It is a smoking, unfortunately. That's why one of the prevention for lung cancer, we said stop smoking and
Stop smoking.
at any age. Oh, I'm old, I'm not going to do it. You can do it. There is so many help there for stop
Right,
smoking.
yeah.
So stop smoking, it's one of the major kind of a prevention. Wearing protective mask if you are at a workplace that you have to
Yeah, I
expose
was
to
going to
something.
ask you about the protective mask. I think that is a very good thing, because if you wear a mask, you have some degree of protection,
Very true.
Like we went to Florida for a seminar meeting. Everybody in the plane is coughing. The Delta flights was full, not
Right.
even a single open.
Yes.
And everybody, so those are the coughing, and they are, how can you prevent that?
Yeah, that's why we said
Mask.
Mask if you have to work in that place. If there is air pollution, that we cannot do anything
Air
about
pollution
it.
you
We
cannot
cannot do
do.
things about it. Things
No.
we can do, we can avoid secondhand smoking. We can stop smoking. That's kind of a preventable.
Right, yeah.
But we always have to remember that if you are not a smoker and you have the symptom we are going to talk about, still you may have a lung cancer, because it can happen to smoker and unfortunately can happen to non-smoker as well.
And non-smoker
Never
too.
smoked or
Yeah,
never
because
exposed to their life, like honestly.
That is right, I'm lucky and privileged to be working with some automotive industry also. And, in the plant, there is so much of pollution
Radiation
going on.
pollution.
We advise them to wear that mask, near the machinery,
Very true.
so it doesn't get
Affect their lung,
affected. Yeah.
Because it's double the risk. So if you have environmental exposure and you smoke, you're
Environment.
doubling the risk for yourself to having a lung cancer.
Yeah, and we are still very lucky, but if you go to third world country, there is so much of pollution going on, you talk to our relatives,
Yeah, true.
like, even in India, I'm from India, and they're telling us there's so much pollution in the major cities,
That's we
so
cannot do.
nothing can be done, with
Yeah.
all those rickshaws and
Very true. That's way higher. Like we cannot control things. We cannot control. Unfortunately, we can kind of prevent it with a mask. But things we have a control. It's a secondhand smoker. It's ourselves. So kind
right,
of,
yeah, we have to.
we have to
yeah.
do like what we can do.
Would you like to comment a little bit about the pregnant women with exposure to? I know it is entirely a
Yeah.
different chapter.
It's a different chapter. Very true.
Yeah,
But it's doubling the risk. It's when she smokes, she definitely affect herself,
Right.
but also it affect her child, and there is
Child,
a different
yeah,
type
yeah.
of disease and anomalies that affecting the
Yeah.
children with the smoking.
so many articles have been
Very true.
written, Journal of Pediatrics, Academy, how these women with the secondhand smoking affecting the fetus, the
babies, and affecting their cells, so they are doubling the risk. Very
Yeah,
true.
so the bottom line is, they have to do something, right?
Very true. Yeah, 'cause stop smoking. I know it's hard, it's not easy.
Yeah.
But if we think about it, I said always, which devil I choose, smoking or cancer, I would kind of have to. Yeah.
Right. So those are the questions. Like when they go to your office, you must have a big series of questions that
The symptom, yeah.
you ask: smoking, non-smoking, drinking, not
Very
not
true.
drinking. Those are also things that
Very
and that
important. And then
alcohol has a lot to do, right?
It's alcohol. It's not by itself, but most of the alcohol it's associated with the smoking.
Smoking.
But as alcohol itself, it does not
It
cause
does
lung.
not,
No,
right,
but
yeah.
mostly of the time we see it's associated with the smoking. That kind of increase the risk. The most important also part we would like to mention is the symptom. What is the symptom of lung cancer?
Symptoms,
Yes,
right.
exactly. Because unfortunately and sadly, early stage of lung cancer have no symptom. There
Right.
is
Yeah.
no symptom. And then when we detect it, it's already, when there is a symptom, it's already advanced and make the treatment very hard. So
Right.
we all should be, it's awareness of what symptom we should look for. Cough that persists and didn't go away.
So many types of
So
cough.
many, but any type of cough that persists. Like we all have cough at a week or and then resolve.
Yeah,
But if
right.
your cough is persist, never go away, that need attention.
Chronic productive
Not
cough.
only
right?
productive, we see it with a smoker. It just cough. I have cough, this lingering cough for a while, didn't go away. That's one of the sign. The other thing is breathlessness, shortness of breath, unusual shortness of breath. Then also tiredness. I feel tired and fatigue. And sometimes also we see weight loss, significant
Yeah,
weight
I
loss.
was going to ask you. I have seen patients who have
unexplained. I
thin,
ate the same.
emaciated, weight
And then
loss.
they tell me I eat the same, but my weight is coming down. So these the symptom we should be aware and we should seek for medical advice because early detection save lives.
Yeah. So that's the most important thing is early detection of any kind of issue, especially the lung cancer, which is becoming so much common, you know, and it can affect you.
It affects lives. Yeah, it changed lives.
It
And then we
changes.
should always aware of that what type of lung cancer. There is two types, kind of generally speaking, the type that called non-small cell lung cancer, which is the most common, and then the type that called small cell lung cancer, which is the more aggressive one and need urgent treatment. If you want me to highlight a couple line of the treatment, also like a treatment options.
Yeah.
Depend on the stage.
Shape, type of cancer.
Exactly. Type and stage play a role in the decided what type, but generally speaking, surgery, chemotherapy, radiation, and there is a newer modality or medication which is called immunotherapy, targeted
It
therapy.
has come so much now,
Yeah, it's
immunotherapy.
way advanced in treatment. It's
Yeah.
increased survival, increase the quality of life. So we are, fortunately, we are very advanced in the treatment of lung cancer.
Yeah, the immunotherapy has come up so much, every time. All the journals, articles, they are talking about this immunotherapy nowadays. How do you kill the beta cells, the alpha
Very
cells?
true. Yeah, it depends on type of tumor. It's increased survival. Like
Really,
it is,
it is.
It's
Has
amazing.
it? Yeah, there's so much has been done about the immunotherapy.
Very
yeah.
true.
And another thing I wanted to ask you, this heart symptoms. I mean, patient is coughing still, but they have heart symptoms. So smoking does precipitate coronary artery spasm,
Very
right?
true. It can
It
affect the
can
whole
cause
body.
it can cause angina, right? At least.
Yeah, but definitely it increases the risk of cardiac disease.
So one has to be careful about that also.
Very true. Smoking is important, and awareness of the symptom is very important.
How long it, yeah.
Yeah, like these symptoms going, so do not ignore it. I always say, do not ignore these symptoms.
Yeah.
Your body is telling you something, so listen to your body.
Yeah, and you talked about the type of the cancer, we don't want to go into too much detail.
Yes, very true.
But anything squamous cell is the most.
It's usually, generally speaking, we divide it into non-small cell lung cancer, which is including adenocarcinoma, squamous cell carcinoma that is associated with lung cancer, and then the small cell lung cancer, which is the aggressive one that needs urgent
the
attention.
one adeno is a little bit localized, but from my just thinking about it, but the squamous cell that affects the whole mucosa, that is more.
Yeah, it depends again on the stage. It can, if you detect early, it's a small and associated with with the smoking. Adeno is more, we see it with the women, especially non-smoker women. But also it's not it can happen to anyone.
Yeah. And also I was going to ask you about, many times we see the patient with whoever diagnosed prostate cancer or something, and sometimes the metastasis goes little nodules.
Yeah.
They go to the lungs.
Yeah. That's I had so many people ask me, what is the lung cancer? Like, to start with, it's just abnormal cell growth in your lung.
Abnormal.
Early detection, meaning we just find it tiny in your lung. But if
Right.
it's advanced, it can go anywhere. It can go to
Right.
the brain, to the
Advanced,
bone, to the
metastasis,
glands,
it can
everywhere.
go anywhere,
Exactly,
right?
anywhere it can go. And they make treatment again harder because that make you advance rather than early stage.
Right, yeah. So this is what it is, all the treatment options depends upon the type of
Cancer.
malignancy, cancer you have. So healthy living, bottom line is, right, a healthy living. So what would be your keynote advice to the listeners who are watching today on your show?
My kind of key advice is listen to your body. If you have a symptom that we mentioned, seek advice because always remember early detection, change life and save life. Do not
Right.
ignore your symptom.
Right.
And that's kind of really what we need to do.
Yeah. Don't ignore your symptoms.
Do not ignore
If-
it. Don't
if you
blame
have
it.
a symptoms, any kind, then you seek for help.
Seek for
right?
help. Be on the safe side.
Yeah.
Always put it in the mind. Yes, lung cancer is very bad, but it's also early detection, improve survival, improve quality of life, change life. So if there is something, do not be kind of
Right.
less fear. Just be more awareness of lung cancer. There is a treatment now.
There's a treatment available, especially all this immunotherapy, the new
Everything.
type of treatment.
Very true. It's not a hopeless disease anymore that we
Yeah.
used to be in the past. We have a cancer, it's a
Right,
hopeless.
right.
It's not a hopeless.
Right,
It's
yeah.
a treatable.
So just this is your. So I like to thank you today for coming to my show, and for our viewers to know she's a practicing physician for pulmonary interventional medicine, and I like to thank our viewers for watching me, my camera crew, and more. And we like to have everybody a very safe holiday, right?
Same
During the holidays, stay healthy, eat good.
Yeah.
Hard to avoid the candies and
Very
all
true.
that, but
We can
stay.
lose it later. It's fine.
Yeah, we'll talk about that later.
Yes.
Thank you again
You're
for
welcome.
coming to my show.
Thank you for having me and have a happy holidays.
Yeah.